I think you've had that, right?
Yep, that's very correct.
Okay, good. So let's see. Okay, so let's start our discussion today. For the listeners, we apologize for a few delays because of the technology, internet hitch. But we are back online, and we hope we're going to have a very interesting discussion on this important topic today. We have an important guest. Whom I'm going to give an opportunity to introduce himself to you. Then right now we shall delve into the whole topic of today and what we think we should cover today, the questions and answers. We shall get all that covered, and this session is being recorded for those who are not able to join us today. They will be able to join. They will be able to listen or watch this recording at a later point. So thank you so much. Mr. Kayode, Dr. Kayode, rather sorry for that. Mr. Kayode, Dr. Kayode, can you please introduce yourself in 1 minute? Thank you so much.
Thank you very much, Kiza. It's a pleasure to be on your platform, the R-Course platform. Thank you for the opportunity to have me speak about coronavirus. My name is Dr. Kayode Fastominu. I'm a public health physician with years of experience working with global health security, working across countries, supporting government at different levels to basically strengthen the health system across key areas of the health system per se. So one area of that is global health security. I've also worked extensively across countries in West and Central Africa, West and Eastern Africa, on projects on immunization and the like, basically just ensuring that government have or make the best decisions to protect the health of their respective citizens.
All right. Thank you so much for your introduction. Sorry, I didn't introduce myself briefly for the viewers who don't know me. I'm called Kiza Hussein. I'm the Africa lead personnel who is in charge of programs that run on the African continent. So our cause is a non-government organization founded in Canada and but based in UK. And its main objective is to work on the SDGs, but also work on all the issues that affect young people and affect the world at large. So we've been running these programs and sessions and awareness sessions online and physically on ground in communities for quite some time now. So this year we had a plan of targeting different SDGs, but because of the unplanned issue like this one, which we're going to be talking about today, the coronavirus, we thought we needed to give it attention, the fact that it has affected many lives of people around the world. Many have got sick, others have died. So we thought we need to talk about this and find a way we can share necessary information that people can use to prevent themselves from catching this virus, but also to change the way they live and impact those people in their communities. That's why we adjusted, and now we're having this session about coronavirus. So thank you so much, Doctor, for joining us once again. Doctor, if I may be correct on this, we never saw this coming. No one ever planned that we shall have a virus of this magnitude, which will affect the world. As of today, if I'm right, according to the Worldometer, it's a platform where different data is shared regarding the coronavirus. And so far, it's recording that around 491,280 cases have been so far recorded around the world. and around 22,166 people have died because of the virus. I don't know if it's true or false, but you correct me where you think so. What do you think for the people who are listening, who have never heard about coronavirus? What do you think the coronavirus is, and how do you define coronavirus?
Oh, thank you very much, Kiza. And thank you for a bit of that introduction, basically trying to contextualize the burden of disease we're facing right now. But for our listeners, coronavirus, as it is a family of viruses that um, cause what you call zoonotic infection. So zoonotic such that the diseases are in animals, but can be transmitted to humans. And this version, if I can call it that, is a novel type within the coronavirus family that originated in China. I was confirmed as far back as January 7th of January 2020 in Wuhan, China. There's been a lot of publications on it, but it seems to have crossed from animals to humans, and as seems to have shown effective human to human, person to person transmission, starting from the epicenter in Wuhan, across the world globally, to Europe, to North America, and of course we're having cases in Africa at the moment. As you rightly pointed out, because of the novelty, I mean, it's new. We've not really studied this type of virus before. And it seems that we are also working to learn about this as the day goes, which is what you would see in how countries are reacting and trying to protect their citizens around this. There's a lot of new information coming out by the minute. One quick example I will point to is the fact that you just called out the burden of over 400,000 cases. If you're looking at the WHO website as of yesterday, again, there's a timestamp, over 189 countries have been affected, 197 countries and territories have been affected so far, have at least one confirmed case, with over 18,000 confirmed deaths and over 416,000 confirmed cases. Not that what you said earlier was wrong, but it just tells you that a lot of things move by the minute and by the second, and that's how grave the burden is. Yes, I think that I will stop there for now and allow for additional questions, so I don't take too much of our time. But I think in a nutshell, that's a bit around coronavirus disease.
Thank you so much. All right, thank you so much, Doctor, for that explanation on what is the coronavirus and where it came from, and a bit of correction on some of the figures. So, well, you just stated that it started from Wuhan in China, and that it can affect animals and humans. Do you think there are categories of people that are more likely to be affected than others? And if so, what are kind of those people who should be concerned about this coronavirus?
Thank you very much, Kiza. So with the data we have available, and again, I will keep mentioning that because we're relying so much on those bit of data coming in across different countries at the moment, for other countries to quickly learn from, but also use to understand the disease as it were. Initially from China, what we understood was a lot of the case deaths were reported in elderly persons, so from 60s and age of 60 and above, the risk were more. But more importantly was that in those categories of people, people that have what we call comorbidities, so existing illnesses such as hypertension, diabetes, existing chronic lung diseases, so bronchitis, lung cancer, were more prone to developing severe having more severe presentation of this illness and were more likely to die. We have seen the same trend across the other countries that have huge cases, notably Italy, currently the United States, and it's been following the same trend. What we're seeing is that persons who are infected and aged above 60, 70, and 80s, are more likely to suffer fatalities, so in essence, death from acquiring these illnesses. So that has been the trend based on data. But again, the data keeps moving, but everybody can get infected, but the severity of the infection and if those infections will lead to death is that's where we see the variation in different ages. So everyone is susceptible, but a couple more are more susceptible because of age and because of existing medical illnesses and conditions.
Okay, so you just rightly stated that before initially it was reported to be affecting the older people, but now according to the reality and so far the data that has been recorded,
reality and so far the data that has been recorded, all the young people and all the categories of people. Is it true or false?
Sorry, I didn't get that. There was a bit of an interference.
Sorry, I was saying for to collect your statement, rather to collect many people's misunderstanding on this. This virus affects all categories of people, from old to young to.
From old to young.
Is it true or false?
That's correct. It affects everyone across all ages. But what I was trying to explain is that then you have higher deaths, fatalities in people who are older. But even in the older population, there are more deaths in people who have pre-existing medical conditions, such as hypertension, diabetes, lung cancer, chronic bronchitis. These things sort of put the body, or people that are even immunosuppressed. So we are finding out that the body can't cope with the stress the virus is putting on the body, so they succumb easily.
Okay, thank you so much for that statement. So maybe for other people, definitely, perhaps even me inclusive, I'd love to know much about the symptoms of coronavirus.
Statement.
Yeah.
Most popular and usual symptoms that tend to be visible to a person who has.
Maybe for other people.
Yes, thank you very much, Kiza. So the virus basically causes a type of viral pneumonia, which is basically chest infection of the lungs. And in all those cases, characteristically, what you find in persons who have been infected is you get a fever, so which means a high body temperature beyond the normal, above the normal. You have a cough. The literature currently and research basically states that this is a dry cough, meaning you're not producing any sputum. Depending on the severity of the illness, there's usually accompanied by shortness of breath, meaning that breathing becomes a lot more difficult and labored. A few other research have report from patients that have had coronavirus have reported symptoms such as sore throat. But I think the most common symptoms are fever, cough, and shortness of breath.
Okay. So, well, I'm a bit, this has been a little bit confusing for people who have some cough and perhaps, flu.
Yes.
Does it mean that if you have some cough and flu, you should be worried about coronavirus?
Not entirely. I mean, so both illnesses are similar, but the severity varies, and they can actually present with very similar symptoms. So not every flu is is coronavirus, but if you have a cough and a fever, um, without breathlessness, I mean, you can have a mild corona, but again, flu is definitely not coronavirus. They have similar symptoms. The same way, for example, in Africa, and malaria is endemic, but when you have a fever and a headache and chills, it can also present as any other disease, even the very grave viral hemorrhagic disease such as Lassa fever. Um, so you can have diseases presenting in similar way, but they're definitely not the same. Of course, the flu and coronavirus are one that are similar in presentation, but they are not the same. So yes, you will not definitely not find that you have so much of body ache that is very pathognomonic of what you find in uh, coronavirus. Also, you will not necessarily see a lot more breathlessness that you will get with coronavirus if you have a flu. You know, a flu would resolve over a couple of days, and you might not necessarily need hospitalization compared to what you get in coronavirus, where the breathing needs to, if breathing becomes very labored, there's a lot of support that needs to be done, and special hospitalization services that need to be provided in a qualified hospital.
If we have to be conscious about, you know, if you have flu, you feel so weak in your joints, you have some cough, and maybe you feel a bit weak and some kind of malaria, you should start be concerned and maybe take seriously about isolating yourself and not get in touch with other people.
Sorry, I didn't get that. I didn't get that at all. Sorry.
Okay, so doctor, thank you so much for that. So I don't know, how does this virus spread? Who carries it? Who is the carrier and who is
So
not?
currently,
How
what
does
we
it spread?
understand and what the science supports is that the virus is spread by droplet infection, meaning that um, it's if an infected person coughs or sneezes and releases the virus particles, if it drops on surfaces, tables, clothes, and the likes, someone can pick it up through their hands and can infect oneself. You know, so and which is why for us to be able to break the chain of transmission, it's advised that we wash our hands repeatedly, and if that is not available, especially for a quick, we can also use alcohol-based sanitizers, so that even if your hand touches the droplet, you don't transfer it to yourself. Of course, touching it with one hand does not mean you will get it. There needs to be a portal of entry, and commonly, this portal of entry is at the orifices on our face. So maybe through our nose, when you are picking our nose, trying to rub our eyes, and then there are openings around the lips that are broken. So that's why it's advised that you wash your hands on a regular.
So I'm kind of get. Can you hear me?
I can hear you. So there's a bit of a lag, but I'm trying to ensure I pick all you're saying.
Sorry, I kind of can't hear you. Are you able to hear me? Okay. Thank you so much. Thank you so much. Well, the issue of quarantine or isolating yourself or social distancing, as it is popularly known. What do you have to say? Is this something that is workable, something that people can really do without, feeling that they're kind of in prison, or you have another contrary view to that?
Absolutely, I do not have a contrary view, and I will take a cue from what I said earlier about how the disease is transmitted. So it's by droplet infection, and as much as possible, we want to be able to break the chain of transmission. The disease moves with people. So if you go to places and you are engaging in conversation, or you are ill and you are coughing around and not guided, you can easily transmit or transfer the infection from you to other persons. Epidemiologically, it's assumed that an infected person can infect two to three other persons at a time. So if you can break the chain of movement and start breaking the chain of transmission by allowing people stay at home, then we can limit the spread of the illness, such that even if you are ill or you are sick, you're coming down with infection, you're not infecting others. You are staying alone, and when you need medical care, of course, you can quickly reach out to respective organizations within each of the countries to get that care without unnecessarily exposing the general population to the illness. So that's basically the concept around the stay at home. Of course, I'm complying at the moment because I'm staying at home. Interestingly, it's a bit unusual, and like I said, because you've got, I mean, compared to what we're used to on a regular basis. But again, like I said earlier, this is one illness, this is one virus or event that we are learning and leveraging what our countries have done. This seems to have worked excellently well in China. Yes, there are a few peculiarities within countries, but the concept is such that if you are ill and you're not moving around, you can't transmit it. So you stay in one place, get the required care you need, and hopefully we get through it together. We absolutely collectively have to take responsibility for ensuring everyone is okay, basically. And I think that's basically the general concept around ensuring that marketplaces are locked down, places that have crowds, such as churches, mosques, parties, you know, um, those avenues are halted for us to quickly gain full control of the spread of the illness.
Okay. Thank you so much, Doctor, for the answer.
I'd like to also know
if let's say to
Sorry, I can barely hear you.
ill
Hi, Kiza. I didn't get that.
me?
I couldn't hear you.
Did you really hear me?
I mean, I can hear you now, but I couldn't hear you for a while. You cut out.
Oh, sorry. So okay, so I just said if let's say you've picked up the virus, just the virus. No.
Yes,
Hello,
Kiza, I
doctor.
can hear you now, but I've not been able to hear you for the last few minutes.
How Oh, sorry. Well, we have to cope up with this.
Can you come again, please?
So I'm saying, if you have picked up the virus,
Sorry, Kiza, I can't hear you. I can't hear you. If you can hear me, I can't hear you.
because I've really lost you.
I can hear you now.
Okay. Are you able to listen really to me?
I
Are you
can,
able to hear me?
a bit now, but I couldn't hear you for a while.
Oh, thank God I can hear you. For me, I had also lost you for quite a few seconds ago. Can we go on? Hello? Hello?
Yeah, hi.
Okay, can we go on?
Can we go?
Can we go on? If you can hear me, we can continue with our conversation on this topic. Doctor? Oh my God.
I can't
This
hear you,
internet
Kiza.
has become an issue. You can't hear me. Should we restart? Do you think we need to restart?
I don't know, but I can hear you now. I don't know. It just came back. Can you hear me?
Okay, Mitra, I can hear you now.
All
Right
right.
now, I can hear you.
So your next question was?
Okay. Okay, thank you so much. So I had asked you if a person has coronavirus, for that person to a fatal incident, perhaps death. Did you hear that?
No, I did not.
Oh my God, this is now internet issues. I think we come on and off. And we can do now. You can, there is also option of texting. I'm going. Have you seen my comments?
Not at all.
Okay, you can hear me now here.
I can hear you. Can you hear me?
Okay, I can hear, but you keep going off and on.
It's I don't know. The network is really not so great.
Right now, I can hear you.
Can you hear
How
me
long
now?
does it take for someone who has caught viral corona to be seriously ill? Yes, I can hear you. Has been affected by the virus to be seriously ill.
Please, can you come again?
Okay, I think. Did you say I call you
Come
again?
again, come again. Like say that again.
Oh, sir. I was saying if someone has caught the virus, if someone is affected by the virus, how long does it take for that person to be seriously ill?
Oh, okay. So at the moment, based on available information, it takes between 2 and 14 days for someone to have caught it and begin to show symptoms. So and of course this varies between different people, but between 2 and 14 days of contracting diseases, symptoms begin to show. And as I said earlier, a couple of the symptoms could be fever, so high body
Okay.
temperature, a dry cough, a few body aches, uh, difficulty with breathing, depending on how severe the illness is. I have to say right now that there's a categorization of the illness. So you can have people who get the illness and are asymptomatic. So basically, they don't have the fever, cough, and shortness in breath, but they've been infected. The body just finds a way to fight it and clears the virus from the system. There are persons who have mild illnesses, so maybe some fever and maybe a very slight cough. There are persons who have moderate and there are persons who have severe forms of the disease, such that they may need to have ventilation support through and have ventilation support supporting the lungs to function well, and they have oxygen delivered to them, of course, with adequate medical medications provided to go through treatment. So you have those categorizations of the illness, and that can present in so many ways, depending on how severe the patient the patient is basically.
All right. Thank you so much for the answer. But so now we take it as 2 weeks. Hello,
Yes, hello.
doctor. Did I lose you again?
I can't hear you. I can't hear you. I cannot hear you.
Well, looks like what I'm going to do is to Either restarted.
No?
Hello.
Yes, yes, I can hear you. Can you hear?
Yes, I can hear. Can you? So much.
Okay.
Okay, let's go.
Uh,
What do you think people in the how do you think it should
prepare for this.
prepare for this?
Just,
Should how do you think communities
just
should adjust to this virus?
I can't hear you, Kiza. I can't hear you at all.
I said,
I said,
how should
how should the communities adjust to the virus?
So, if I heard the community, how should they be prepared? So as much as possible, depending on every country has different proclamations or decisions to make, or different strategies they've adopted to respond to the outbreak. As much as possible, I will compel everyone to comply with those restrictions. They may sound tough, but I think they are essential in ensuring that we collectively take responsibility and put an end to this outbreak. Basically, we have to break the outbreak. You know, it's important to know that you need to take care of yourself. So practice self-hygiene in addition to where required. If the government has asked that you self-isolate and stay indoors, please ensure you comply. It is very, very important for the collective good of everyone, not just for you, but this is one illness where our collective behaviors has a bearing on us. So even if you're staying at home and your neighbor is not, your neighbor is at risk to you. So there has to be complete and full compliance to any of those um, recommendations made by government. But on top of that, hygiene is also needs to be practiced. So good hand hygiene, washing hands, and at least with soap and water for at least 20 seconds, and ensuring that you use alcohol-based sanitizers to sanitize hands. And when that is done, even when that is done, you limit the frequency at which you touch your face. That is quite difficult to do as well, especially when you become conscious of that fact. It's a bit difficult because we knowing unknowingly rub our face multiple times, in minutes to hours, not even talk less of a day. So there's a high probability that if we're not practicing good hand hygiene, we can infect ourselves basically, and for that we need to be able to collectively.
Okay. Thank you so much, Doctor, for your answer on that. Still on this coronavirus. Well, many diseases have come up, or many viruses have come up, and the world has been so responsive to find as possible, as much as possible. But for this virus, so far the world has not, in order to have the vaccine for this, a vaccination for coronavirus.
As regards vaccination, at the moment there is no vaccine, but of course there are a lot of efforts to quickly accelerate the development of one. There are a couple of those research going on now in the US and across the world, and they're in different phases. But we have to know that vaccines need to go through different processes before they are made available to the population. There needs to be robust research, and the timeline from identifying a vaccine and it being available to used in human population ranges between 12 months to 18 months, and that's even considering a couple of accelerations in between that timeline. So if it's available, it would be great, but the timing is what is um, a bit of a hindrance because, as we said earlier, this disease is one that the indices keep changing on a daily basis, and we can ultimately wait till about 18 months, without doing anything, so which is why my response earlier to your question was that we need to comply with government regulations, ensure personal hygiene, and take full responsibility to make sure that we break this outbreak and we come out of it together strongly.
All right, thank you so much for that. Definitely, for now, we know that there's no vaccination for now. So, but we have had some countries have been using some particular medication to treat the virus. Well, I for now, I know that perhaps even you've heard about the chloroquine. Do you know anything about that? Do you think it's an effective medication for now, or do you have other contrary view on that?
So I mean, like I said from inception, this is one illness that is novel, so we do not entirely know everything about it. That said, for people that have received treatment and for a lot of the publications that are available, there are a couple of common regimens that are used. Antivirals are mostly used, and they've been shown. There are varied reports that point.
Doctor.
Sorry. There are varied reports supporting the efficacy of these medications for treatment of COVID of patients that have coronavirus. Chloroquine CQ is one important one gaining grounds right now, but following research, um, the WHO has come out to say categorically that it's not the go-to medication for now, and that's largely because the evidence available does not really support it wholeheartedly. Again, you do not want to do harm or cause harm unnecessarily. And I'll tell you, for example, there are a couple of countries once there was a proclamation about chloroquine, use of chloroquine, people started overdosing on chloroquine, and that gave rise to a couple of side effects. So those are things we do not want to allow fester on for too much, especially when the science doesn't back it effectively. There's no evidence per se to support that chloroquine outrightly cures coronavirus in persons infected with the virus.
All right, thank you so much. So we now know that chloroquine much as being used, it's not scientific.
So, well,
so
we wish also to know. There's some
a lot of information has been circulating in social media on news
about the possible cure for coronavirus.
platforms.
I've learned
So far,
from your. Have you learned about this kind
so
of
much on this and this kind of information and
how
information on that?
So there is a whole lot of information out there. Well, I mean, right now we're sort of in an infodemic as part of a pandemic. There's so much information. The majority are false, and that is causing a lot of panic and a lot of fear in people because of social media and because of tools that are available to rapidly share information. A lot of these go out en masse, and as is contributing to a lot of the responses a lot of the feedback we're getting in responding to this. There are common ones, of course, as I mentioned earlier. Chloroquine was one, and we've seen the side effect in a couple of countries where people started overdosing on chloroquine. That is harmful to health. There have been talks of use of ginger and hot water. Again, those are not supported by science and they are entirely not true. We've also heard a lot. I mean, there's a common one about coronavirus being developed in the lab. That is false, and that is not true. As I mentioned earlier in my introduction, coronavirus is a zoonotic disease, such that it's and has a tendency to spill over from animals to human, and that is what we're seeing in this case. A few more around the fact that Africans cannot be infected with coronavirus. That's false. I mean, as of today, there are over 1,800 cases of coronavirus in Africa. A proportion of those are Africans who have been affected. Yes, maybe a couple of them are travel related, meaning they traveled back to their respective countries from countries where there's ongoing community transmission of this virus, but they've been affected, and there is that propensity for them to also catch the illness, and they can transmit this infection locally. So that is also false. People have also talked about the weather being too hot for the virus. Again, that is not true. As we currently have cases in countries such as Nigeria and as far as North Africa, where the temperature is a bit higher. And across Africa, basically, as of today, again, there are about 42 African countries that at least one case of COVID has been reported, with less than 1,000 deaths. Less than 100, about 100 and a few hundred deaths reported across the continent. So there's a lot of this, and in times like this, there's a lot of misinformation. What I will encourage us to do is, as much as possible, take responsibility, confirm information before you share. Don't be a part of the infodemic that is prevalent right now. If the information is not credible, do not share it. Always look through to verified information sources from the respective ministries of health and global public health organizations such as the WHO for credible information on the outbreak across board.
Thank you so much for your response. So maybe my last question on this. We've seen a lot of doctors and a lot of healthy institutions doing a very important role in this global crisis. We've seen the nurses, the hospitals being overwhelmed by the influx of patients. But for me, I thought that this should have told us on to learn how to prepare for this kind of emergencies. Going forward on the coronavirus, what do you think the world should do in regards to preparing the healthy institutions to be prepared for this kind of incidences or rather crises?
Yeah, thank you very much once again. And I think this is the question a lot of African countries are beginning to ask themselves, or they should be asking themselves once we eventually, in fact, from now on. And again, I also think this is not just for African countries, it's the world at large, because everybody is struggling to get a grasp of this disease. So preparedness is very important, but how prepared are we? That's a big question. Before now, and as far back as 2005, there's what we call the International Health Regulation. We basically bind countries and ensure that countries take the requisite steps to have the relevant capacities to prevent, detect, and respond to public health emergencies. There are resources, there have been tools and evaluation frameworks that allows countries to self-evaluate and also report on their readiness capacities. The WHO has led this over the years through the joint external evaluation, and these results are available publicly on the WHO website. These give a sense of where the various weaknesses are in Africa, and based on the last report across the continent, there are significant weaknesses across the core areas. But it's what we do with those going forward. That's the key thing, because it is coronavirus today. There's a possibility that there's going to be another one in the next year. So how prepared should we be? I think a lot of our countries should be able to invest in core health system strengthening. Have the capacities, facilities to be able to take in staff, not staff, sorry, patients, critically ill patients, work collectively with their medical personnel. There's a lot of brain drain in Africa. We need to be able to retain our doctors and have them available for us in times of need. These facilities need to be available for them. The med schools, the teaching facilities need to be available. How do we manage data? How do we ensure supply chains are not disrupted? There's a whole list of key things. How do you ensure that African countries need to make sure that health is priority and health is adequately funded. It's a huge gap across countries because health is not a big seller for politicians, unfortunately. But I hope with this we begin to see the need to invest more in health, and more importantly, understand the concept or the notion that health is indeed wealth. Of course, I'm saying that because the coronavirus pandemic has affected the global market. Supply chains have been disrupted, commodities are not moving, so business is halted. So this is an example of how one sector can have immense impact on other sectors of life that we depend on for survival. So we need to do more collectively, invest more in health systems, and ensure that we have the capacities in-house to solve our own problems and respond wherever and whenever this is required.
Hello, Doctor.
Yes, I can hear you, Kiza.
Thank you so much. So I just said the last question on this. We know that the nurses and doctors and hospitals, they are doing a tremendous work to save lives of people who are ill. But we also know that the health practitioners are not immune from the virus. What do you think should be the responsibility of the common people, the population? How do we support these kind of people? How do we support the institution, the health institution, to not overburden them, so not put their lives in danger? Yet we need them more than ever.
Yeah, so we definitely need them. They're basically a line of defense right now. They are human, so they need a lot of support. They need a lot of encouragement. There's a lot of while they are doing this 24/7, I'm sure they will need to feed, they will need to drink, they will need to stay alive. So within the communities, there's so much support that can be provided to healthcare workers. I've read of countries where whole five-star hotels have been donated to healthcare workers for them to recover and recoup while they are changing shift, because they are in the front line. It's difficult for them to go back to their families, so they don't infect their families, their immediate communities. So some organizations have created that avenue for them while they are responding. Feeding has also been taken care of by a couple of organizations that I'm aware of. In a few countries, insurance has also been guaranteed, so that if anything happens, they are insured, and with that gives a lot of confidence to any healthcare worker on the field. As much as possible, we like to pray in Africa. I think we need to also pray for our healthcare workers. They are stretched, they are drained, but they are helping us fight through this. And I think if we support them as much as possible collectively, we should be able to do better and come out victorious, so to say.
All right. Thank you so
much, Doctor, for your
contribution towards this discussion. I can imagine whoever is listening or who will listen at a later point will find a wealth of knowledge about coronavirus and how they can prevent it and protect themselves from catching the virus. Lastly, also on this, on the last question I just asked you, I think on my own contribution towards the healthy sector and nurses and doctors who are putting their lives in danger to save our lives. I think the best way to do it is, first of all, to comply with the guidelines of the nine ministries and government so that we don't get sick and overburden and overwhelm the healthy sector.
That's very correct. I agree with that. Maybe I just say right now, also in addition, for a couple of countries, they're setting up different approaches. So yes, the health facility is one, but the triaging can be done via phone calls. So there are helplines or helplines across countries. I don't think we should panic, and which is why I mentioned earlier we shouldn't just try not to share false information because that leads to panic. And with panic, you want to speak to someone immediately, and that overburdens those call lines and call centers, so that the people that really need it don't get to use it. But by abiding, and as Randy pointed out, abiding by the restrictions to stay at home, we do not expose ourselves unnecessarily to the illness or to the virus, meaning that the risk of us presenting in a health facility is reduced, and thereby reducing the caseload, or the number of cases that are various healthcare workers will be required to attend to. So it's a whole of society approach, if you allow me to use that, where we all have a role to play, and our behaviors affect different aspects of the population. Of course, at the moment is how, if we stay indoors and prevent spreading of these diseases, we would not put so much burden on our healthcare workers who are already stretched at the moment. So thank you for bringing that up. That was very apt.
Hello.
Hello, did you hear what I said? Can you hear me?
Okay, thank you so much. Yes, I just had the last remarks, but I don't think I've had the what you just said in a few couple of seconds ago, maybe in the last 5 seconds ago.
No, I didn't. I actually was hoping I was going to hear.
But
Right.
okay, well, let's wrap it up. I think you've mentioned quite a number of things from how we protect ourselves, how do societies have to get prepared for this, and what is the role of each individual in contributing towards not spreading the virus and making sure we keep ourselves clean and maintain the social distancing and stay at home. Then of course we have to, as we stay at home, we need to keep ourselves fit and healthy. That's doing exercises at home if you're not allowed to move out. And of course we have to make sure that we stop circulating misinformation. We need to only share reliable information that has been obtained from reliable sources. That's like World Health Organization. Other information like eating garlic or doing this and that that is not really scientifically proven, we should I think we should rather avoid doing that and misinforming the world. Otherwise, I wish to thank you, Doctor, once again for your contribution towards this discussion, and I hope we shall have more other lines of engagement going forward in the near future. Thank you so much to you and to your family, and stay safe and stay home.
Thank you very much. Thank you for having me, and I look forward to those contributions going forward.
All right. So we call it a day for now. Until we get back, we shall be able to share our recording with the public, and hopefully you also have to have a copy of this. Thank you so much, Doctor. Have a nice day.
You too. Bye.